Well, thank you very much, Mr. Chairman. Thank you to all of our witnesses who joined us today. We appreciate it. Mr. Chairman, my colleagues and I look forward to working with you again this Congress on behalf of workers and communities and families across our nation, as we have under your leadership for the past 2 Congresses. This is the first time we have met since your announcement, and on behalf of all of us, thank you for your bipartisan approach to the work we do on this committee and this institution. You and I, along with a lot of members in this room, have been able to work in a really important bipartisan fashion to address a lot of the issues that our families face, as you well know, from ESSA to 21st century cures, opioids epidemic, and a lot more. So on behalf of all of this on us on this side of the dais, I hope we continue that tradition, and thank you for your tremendous work.
Thank you very much.
I'd also like to welcome our new members of the committee. Look forward to having our new colleagues. Senator Romney, welcome. Senator Braun, who's joined us. Senator Rosen, you join a long tradition in this committee of bipartisan work as we address, as the chairman outlined, the primary care cliff, higher education, healthcare costs, retirement security, and many other issues. So welcome to this committee. Look forward to working with all of you. And finally, I just want to say I'm really glad that President Trump listened to the workers and families and communities who were harmed by this shutdown and ended it. That pointless 35-day shutdown not only caused a lot of damage, but wasted the first month of this Congress. We have a lot of important work to do, starting with the topic of today's hearing of primary care providers. After hearing from families across my state of Washington about the role that community health centers play in their lives, and visiting a lot of centers across my state to see the good work that they do firsthand, I'm really looking forward to all of our witnesses' testimony and perspective on this issue. Community health centers serve over 27 million patients a year, many of them in rural and underserved communities. And teaching health centers and programs like the National Health Service Corps help bring qualified health professionals to communities who are in need. These programs make it possible for millions of patients and families to get the care they can afford close to their home. And they play a critical role in the local response to national health challenges like the opioid crisis. But this time last year, they were in the middle of an entirely different kind of crisis. Community health centers were left waiting without funding and uncertain when Congress would extend funding for programs that support them and their staff and give patients access to the care that they rely on. This time last year, community health centers across the country were forced to cut back hours and staff and services and halt planned expansions, like in Spokane, Washington, where a new opioid addiction treatment services initiated to combat the opioid epidemic was jeopardized by that funding freeze, or out on our Olympic Peninsula, where plans to expand behavioral health services was put on hold, or in Whatcom County, where they considered canceling construction plans for new medical, dental, and behavioral health care facilities. This time last year, community health centers were left wondering how to pay their current staff and attract new professionals. Ferry County, it's a rural area with fewer than 4 people per square mile, where the funding uncertainty left a center unable to sign annual contracts for needed medical staff and managers. This time last year, some community health centers had to figure out ways to cover basic but crucial annual recurring expenses like renewing the lease for their building. In Yakima, Washington, clinics in some of our most vulnerable communities were at risk of closing. And it wasn't just Washington State. Centers across the country faced these challenges. Elsewhere, a teaching health center closed, meaning the residents there, the healthcare residents, healthcare providers who are willing to forego the draws of an academic hospital, roll up their sleeves and serve patients and families in communities with severe professional shortages, face the harrowing prospect of having to scramble to find a new residency program and possibly redo an entire year of their residency. Fortunately, one of our witnesses today, Dr. Waits, stepped in and helped many of them to avoid that catastrophe, and I hope we'll be able to hear more about that in his testimony today. In the end, Congress was able to come together in a bipartisan way to fund those community health centers and the other critical primary care funding. But if funding runs out again this year, we will be right back where we were a year ago that I was just talking about. So it's clear to members of both sides of this aisle we need to do more to provide stability for communities and the health centers they depend on. So I'm very glad that Chairman Alexander and I were able to introduce legislation to do just that. While it's not the bill either one of us would have written on our own, it lays down a very clear bipartisan marker for providing these programs with long-term funding. Our bipartisan bill will provide 5 years of stable funding for our community health centers and give them the certainty that they need to bring on new skilled staff and offer new services and make sure patients have the care that they need close to their home. And as the chairman said, it extends funding for teaching health centers and the National Health Service Corps, which encourages medical students and doctors to work in underserved communities and fund at least one entire cycle of a family medicine residency. Funding these programs for the next 5 years will give health centers greater confidence. They can recruit the professionals that they need, and medical students, residents, and others greater confidence in their decision to work in an underserved community. So I'm very pleased that we were able to introduce this. I very much look forward to the hearing today, Mr. Chairman, and thank you for holding it.
Thank you,